My name is Dr. David Keith. I'm a family physician here in Spencer, Iowa. I'm also on the Clay County Public Health Board, and I'm here today to talk about COVID-19 and the serious nature in which we're facing with this epidemic actually climbing again and becoming worse in our community than it was before. In Clay County, we have over 500 cases, and our neighboring counties are also rising as well. In fact, at this time, we have a higher 14-day average peak than we've had previous, and almost double or more. And that trend is not decreasing at this time. As you know from the news, almost the entire country is on fire with COVID-19, and particularly the Midwest. And right now, our case counts are so high that we're seeing many of the repercussions of a community with a large burden of disease. In fact, hospitalizations, transfers to higher hospitals, deaths, all of those things are happening, including children becoming quite ill and having to be sent for further care in other hospitals. So as we've been saying from the beginning, the most important thing we can do and understand is, first of all, COVID is a preventable disease. Just as any other infectious disease, if we learn the ways to protect ourselves against it, then we can prevent it. And so the way to prevent COVID-19 is to wear masks everywhere we go in the community and social distance. And then also wash our hands, because even if we're wearing a mask, if we haven't kept our hands clean, we can spread it easily, as it comes from respiratory droplets and from our mouth, from our nose, things of that nature. And so it's extremely important that we honor those things first. And next, if you are exposed or you know that you have it, you must stay home and isolate. And in fact, even in your family, you can isolate. We've had cases where one member of the family has it, but they isolate within their home, in the same room and the same bathroom, and that no one else can get it because they're isolating. So we know that it is preventable in that way.
What's mask protocol? What's proper hygiene and stuff for masks?
So most importantly with masks, it has to be at least a double layer cloth. So the gaiters that people really like are great and they look cool, but they not protect or prevent. Remember, a mask's initial primary role is to stop the spread of disease from me to someone else. So if I happen to be carrying COVID-19 and I don't know it yet, which I could be spreading it 2 to 5 days after I contract it and not have symptoms, my respiratory droplets when I cough, sneeze, talk, sing will not reach you if I'm wearing an appropriate mask. Right now I have my mask off because no one is near me. I am far away from anyone else. But a mask like these surgical masks, have double or triple layer thickness to them, and so they catch all my respiratory droplets. A single layer piece of cloth would not do that. Also, the masks with valves on them are inappropriate because it'll protect you breathing in, and there is some layer of protection if we are both wearing masks and one of us could spread it, but the valve will also allow air to come right out of your mouth and come into the community, so make sure that it is not valved and to free air. You want to change them if you can daily. COVID lives on surfaces for approximately 3 days. So oftentimes in the clinic, when we were at short supply, we would put them in a paper bag and reuse them several days later. And so if you use the same mask, I would recommend you changing it out, because if someone else picks it up or uses it in your car, even your family. For instance, if I am a high-risk exposure as I take care of people in our community. I have taken care of COVID patients in the last 2 weeks. And so I wear appropriate gear from head to toe to protect myself and my family. But if I happen to contract it, I'm wearing masks and I don't want to share them with my children or share it with my wife, just in case it's on the inside lining of that mask.
So with winter coming on, folks are going to kind of start getting sick. How are you going to know if it's influenza or just the cold, or if it's COVID? And what's the testing protocol for that?
So the most important thing to understand is that if you have if you have cold-like symptoms, which could be anything from COVID, influenza, RSV, or influenza, we want to ask you to isolate. I mean, unless you need medical care, do we need to know the answer, is the first question. If you need to know for your job or for work or for other things, there's opportunities to test yourself. The hospital's working on a testing site shortly. There'll be drive up for everyone. The school has in place a new protocol provided by the State Hygienic Laboratory where we can test children with rapid testing, and also call the clinics and ask your provider to help you figure out what you need to do. We have at the Avera Medical Group Spencer Clinic a respiratory clinic just for things just like this to help you decide. It is very difficult to differentiate between influenza, RSV, strep throat, and COVID. There's a lot of nuance between them, and so asking your provider to help you. But if you have the opportunity just to stay home and doing okay, that's what I would recommend right away.
So should we get a flu shot?
Yes, I would recommend highly that you get a flu shot. So actually, a study I just saw last night from Britain showed that flu vaccines may have some protective measures for COVID. It's just initial stages, but wouldn't that be amazing that it would help us in some way? But getting your flu shot will help eliminate one of the many respiratory viruses that will be present in our community this year. Historically, our town and our community does very poorly with influenza because of we don't social distance, we don't use masks in the past. I'm hoping that this year, as we are more mindful of this, our influenza numbers will be much less, but we still lose people to influenza every year. It is also a preventable disease. It is also a deadly disease, but COVID is 10 times more deadly and 10 times more contagious. And so far, we've seen that. We've lost at least 4 members of our community, others who have died or we've brought back and sent to further care. It is hurting our community at this time, and not only personally and health-wise, but financially, and as families have to stay home from work, as children are sick and mothers and fathers have to miss work, or that the parents, grandparents, aunts and uncles have to be participating in their care as well. It has a greater repercussion than just our health. The most important thing as a community is to be aware of the issues of spreading. Have you heard of someone else contracting COVID? You probably have, because right now in our community, hundreds have had it, and likely even more than that, 2 to 3 times that. And some estimates even say 5 times more than that, because we didn't, of course, test more than the 500 we have positive for. We're only recording positive cases, so we likely have many more. For instance, if I had COVID, I've been tested multiple times in this year. If I had it, likely my family's going to get it, and so there would be 9 people with COVID, but yet I'd be the one to be tested and we'd all isolate. So remember, it's more than just those 500. And because of that, we as a community need to do everything we can to protect each other. It is our duty as members of our community, as well as for our health of ourselves and our families. I have unfortunately been a part of death from COVID in our community, and it is very tragic because it is preventable. And so I want to stress that to you, that we can prevent COVID from spreading in our community. Please help us do that. Local businesses, I invite you to invite every patron to wear masks. You know, whether you're serving them food or whether you're serving them materials and goods, there's ways we can prevent. Your workers should be wearing masks, but remember, the masks only prevent your workers from spreading it to your patrons, not your patrons to your workers. And so invite everyone to wear a mask. That will be the safest way. You notice that some of our big chain stores are already doing that. They're seeing the wisdom in it. It's protecting, hundreds of people across and thousands of people across their whole business. Our community is our community, and we must protect it. And then when we're at home, wash our hands. If we have symptoms, please isolate. Seek medical attention if need be. In this time, with influenza, RSV, and other respiratory viruses hitting us, it's so important to be vigilant and careful, because even a mild cold for one could be death for another. And so if we will take the responsibility upon ourselves to monitor and help take care of ourselves and our community, we will be better off in the long run. We have many months ahead of us, and probably maybe a year until we have an appropriate immunization and appropriate measures to combat this pandemic. And so we need to be vigilant now, or we will see the repercussions of that for months and years to come.